Hello, everyone. We're going to talk about a very important topic about mitral valve disease or mitral stenosis. Let's revive our knowledge of where is mitral valve. Mitral valve is a valve which is between the left ventricle and the left atrium. It's like a door which regulates with every beat the blood coming from the left atrium into the left ventricle itself. Um, the valves is some of the most beautiful structure ever made, and there is no comparison whatsoever what we can make and what nature and the God Almighty has already made. So the valve, there are two major cusps of the mitral valve, which is anterior and posterior, and they are tethered with such a advanced technique with the what we call tendoning to the muscle of the ventricle itself. And this is just incredible the way the mitral valve is such a complex structure. But the beauty is that with every heartbeat, when the ventricle contracts, it's also like a tugging effect, and it actually closes the valve itself. And that's it happens like 72 times every minute. And you can imagine it's millions of times in a lifetime of a person. This is just incredible that without us knowing, without us even thinking about it, the valve and the structures are working so beautifully. It's very different from the aortic valve itself, which is we talked about is trilumen like a Mercedes-Benz sign, but this valve is way more complicated in structure and function itself. And the reason for that is because it needs to control the blood coming from the left atrium, which is a very low pressure chamber compared with a very high pressure, which is the left ventricle itself. As you can imagine, the pressure in the left ventricle is anywhere between 120 going up to 160, 170. In sometimes hypertensive patient, is more than 200 millimeter of mercury systolic, compared with 10 to 12 millimeter of mercury pressure, which is existent in the left atrium itself. And if you look at the left atrium from the back, you can see there are four pulmonary veins which actually takes the blood from the lungs, purified blood. It comes to the this chamber, and then it goes into the left ventricle. So with every time when the heart relaxes, this mitral valves open and allows the blood coming from the left atrium into the left ventricle, and this ultimately leads to the filling. And as soon as the ventricle starts to contract, the mitral valve starts to close. And that's the beauty of it. As soon as the pressure is equal between the left ventricle and the left atrium, the mitral valve totally closes, and this helps to for the contraction for two wonderful events that happens. So the blood can be pushed from the left ventricle into the aorta, and then the at the same time with the diastole, you have the blood from the lungs coming through the pulmonary veins into the left atrium. And then when the heart relaxes, the same circle starts, and you have the blood flowing directly with three processes into the left ventricle, including the gradient difference as well as the kick of the left atrium, which pushes the blood into the left ventricle. So what can go wrong with the mitral valve? Mitral valve can be narrow with mitral stenosis. The number one cause has always been rheumatic fever. In third world countries, it is still very common when you have a fever due to rheumatic fever, due to streptococcus, and that leads to chewing of this valve itself, and it can lead to mitral stenosis, and the degree of mitral stenosis, sometimes mitral regurgitation as well. And then you have other causes, dialysis patient. Any valve can be affected with dialysis. As we mentioned, with the aortic stenosis, the same story. You can have a congenital, but as well as severe. We have a end-stage renal disease on hemodialysis patient. They can have a degree of narrowness, narrowing of the valve as well. So the mitral valve, you can have a stenosis, and then you can imagine the blood just damming into the left atrium and ultimately into the lungs, and the atrial size become bigger and bigger. And the atrial size, when it's become bigger, it has other problems, including atrial fibrillation, which some point we'll talk about that, how we're going to tackle that. But certainly, so you feel shortness of breath, you feel swelling of the legs, heart failure symptoms can come quite quickly, or the valve can be leaky. So every time the ventricle contracts, the part of the blood goes back rather into the aorta, it goes back into the left atrium itself. And that can, again, has a very bad effect, as the heart has to pump double the effort. It has to make double the effort to get into the blood get into the aorta, and this way you feel short of breath, and ultimately sometimes arrhythmia happens, and sometimes you have dilatation of the ventricle itself. So these are some of the symptoms and signs. How do you diagnose it? Again, a good listening stethoscope with a good ear of a physician can listen to the murmur of the mitral stenosis as well as mitral regurgitation. And to confirm it, we need echocardiogram. Echo is like ultrasound of the heart, and this actually will we should be able to find out if the valve is leaky. A little bit of leak of the both mitral and the tricuspid valve is very, very common. It's nothing to worry about, because the valve structure is so complex, and due to difference of the different age groups and different people, a little bit of leakiness of this valve is not very uncommon. So you can have a slight leak which really doesn't have any hemodynamic effect. And echo is nowadays is so sensitive that it can pick up even smallest of the leaks of the mitral valve. So there's nothing to be overly worried about. But the worry starts to happen when you have a moderate or severe degree of mitral regurgitation and or stenosis. That can lead to multiple problems. One of the big issues with the dilatation of um, the the left atrium is because left atrium has a portion which is not on this model is not very clear. It's called left atrial appendage. It's like a little sac which comes on the back of the left atrium, and that can harbor a lot of clot in there, and that can lead to stroke, because clot can travel from that appendage into the left atrium and then through the mitral valve into the aorta, and God knows where it will settle. Hopefully not in the brain, because it can cause a massive stroke. So the issue with the dilatation of the left atrium is not such that it has any major problem hemodynamically, but more importantly, there is a blood clot formation, and development of atrial fibrillation is a key for development of the thrombus formation. And then ultimately when the clot travels to the through the aortic valve into the other parts of the body. So the management itself for the mitral valve is, if it's rheumatic mitral valve, certainly in many cases mitral stenosis can be treated with balloon valvuloplasty, which means you go into through the leg into the inferior vena cava, which is a venous capacitance vessel, into the right side of the heart, and then from there you can go through the septum, which is a wall between the left and the right atrium, and you can puncture that septum under X-rays and go into the mitral, come here into the mitral valve itself, and you can inflate the balloon, and the narrow valve can be treated effectively by just separating the leaflets. That's one option. The other option is obviously you have a mitral valve surgery. The stent with a valve, just like for the TAVR procedure in the aortic valve, is still in progress, and still there's a lot of work needs to be done, and work has been done. Hopefully within the next year or so, you can have a new valve, just like very similar to the aortic valve with a TAVR procedure. One of the other things you can do is, if the valve is very leaky, you can actually go with what we call a mitral valve clip. You can clip these the mitral valve, which is very, very big and expanded. Actually, you can clip it and make it narrow, or make it two smaller valves, and this way the burden of the blood going from the left ventricle to the left atrium is lesser than it should be. So the shortness of breath and other symptoms and overall mortality benefit could be achieved. But at the same token, people who have mitral regurgitation, they can have some of the afterload reducing medicine, which we mentioned in the previous video, hydralazine and other, which can help. Obviously, the diuretics is important, aspirin, or if you have atrial fibrillation Anticoagulation is very, very important. So all of these treatment options should be discussed with your doctor. Hopefully this video was helpful. Thank you for your attention.